It's 11 a.m. here in Seoul. I'm Oh Seong at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the COVID-19 situation here in the nation. In just a few moments now, we're going to cut into the briefing room at the Sejong Government Complex with simultaneous interpretation available in English. We're going to go into the briefing room now where Yoon Tae-ho, Director General of Public Health Policy, will be sharing the latest figures and updates on the COVID-19 situation in Korea. So he is going to update us on the latest number of infection cases, especially with the sudden spurt of COVID-19 cases we've had recently in Seoul. Now, as you can see, we've just cut into the briefing room and it looks like the briefing is just about to start.
Let us now begin our regular briefing for May 12th, Tuesday. As of today midnight, we have 27 new confirmed cases, and related to Itaewon Club, we have 12 in Seoul and Gyeonggi, 8 in Gyeonggi, and a total of 24 have been reported as of the midnight, and currently the total number stands at 94. And the 5 are imported cases. And starting from the 10th of May, we have a total of confirmed cases that stands at 10,936 as of today midnight, and 9,607 have been discharged following full recovery. The death toll stands at 258, with 2 more fatalities as of yesterday. I extend my deepest condolences to the deceased and the members of the bereaved families. Today, the KCC held a meeting presided over by Health Minister Bang Neung-hoo to discuss agendas, including the local government's quarantine, to act in jointly to combat the COVID-19 outbreak. And he said that related to the Itaewon Club infection, he said that our quarantine system is put to test, and he called for the cooperation from the public. And he also highlighted that discrimination and isolation could lead to a great hindrance against the government's quarantine efforts. And today is an 49th International Nurses Day. And today, as we celebrate the 200th anniversary of the birth of Nightingale, we want to specially celebrate this occasion. And we also saw a great outbreak here in the country with COVID-19, peaking with over 800 patients a day. And we were able to control the outbreak to a certain extent thanks to the dedications of the nurses as well as other medical practitioners. I extend my deepest gratitude to all of them once again. Prime Minister Chung Se-kyun has also mentioned that nurses are at the center of securing the health of the public, and he extended his gratitude to the nurses who are fighting on the front lines. And the government will also continue to support the country's nurses so that they can continue to give medical services at the medical sectors, and we will continue to provide increased support. And once again, we would like to acknowledge the fact that the nurses are putting their dedications and sacrifice to fight against the COVID-19. And today at the KCC meeting this morning, we touched upon the issues of the Itaewon Club infections as well as future plans to react to this cluster infection. And in Seoul City, we have secured the list of over 5,700 list of people who have visited the Itaewon Club facilities. And out of the over 5,500 list, we have talked on the phone with over 200 people. And as for the 3,000 people who have not been reached through phone, we have given the SMS SMS text messages, and we are also securing the information through the mobile traffic through the networks, and we also have secured our CCTV surveillance footages for these people, and the government has swiftly established a TF team to carry out the investigation among these people, and we are closely cooperating with the police agency in order to track down on these visitors who are not in touch. And the government highlights that anyone who has visited the Itaewon Club facilities starting from the 30th of April to the 6th of May, we are providing free of charge screening testings, and they are done anonymously so that their personal information is not revealed. And as for now, an average of 5,000 to 6,000 people are getting screened. However, this soared to over 10,000 a day as of yesterday. And relating to the Itaewon Club case, we are carrying over 7,000 screening testings. And the quarantine authorities will continue to vow the protection of the privacy of these people. So if you need to be tested, please come to the screening centers. And the Health Ministry has also issued an administrative order recommending that all nightlife establishments suspend operations for a month starting from May 8th. And the local governments are also putting in place the administrative order to ban large gatherings of people. And the government is utilizing all possible resources to track down any of the future contacts, and we are exerting our full efforts in diverse means. So we ask the members of the public to please cooperate with the quarantine measures put forth by the government. Each of the municipalities will also continue to monitor the updates of the administrative order that has been put in place, and it will continue to put in place penalties as well as the seizing of businesses if they violate such means. The Education Ministry has delayed the school openings for the senior high school students by a week, and this has been postponed from May 13th to the 20th of May, and the rest of the school openings for other grades are also delayed by a week as well. This reflects the cooperation and the negotiation between the KCC and the Education Ministry after we have identified the cluster infection related to the Itaewon Club case. And we will be fully preparing ourselves to reopen our schools as soon as possible. We will be monitoring the school quarantine schemes, and we will continue to provide increased support for the schools. And in relation to the Itaewon Club cluster infection, we will make sure that these will not lead to another widespread cluster infection. And I believe that many of the public have such concerns. And in order to curb the further outbreak, we are establishing very tight-knit contract tracing, and we are also expanded the guidelines for the subject and the target of the mandatory screenings to include sore throats and so forth. And we are also expanded the COVID-19 in the monitoring target and subject of the respiratory systems that need to be monitored. And in order to curb the further spread of the imported cases, we have put everyone who are coming in from foreign countries to go on mandatory 14-day of quarantine, self-quarantine. And as for nursing hospitals and mental hospitals, we have expanded the screening facilities and screening testings for these facilities, and we are screening anyone who are suspicious of the COVID-19, and we are putting them on a self-quarantine. And earlier this month, we carried out the epidemiological investigation and screening of every individuals within one facility where they had the pneumonia symptoms. And we also continue to test these people who have suspicious symptoms. And as for the high-risk group, we are preemptively carrying out these screening testings. And as for the military people who are entering the training in Daegu and Gyeongbuk area, we are doing the testings for them as well. And we are also increasing the testings for the non-registered foreign laborers as well as the people who live by themselves. And also in order to monitor these COVID-19 viruses, we have developed a pooling investigation and examination scheme, and we will be intensifying our quarantine measures going forward. So these are just some of the tight-knit scheme that we have, and we will continue to put our utmost efforts in utilizing all of our possible resources to curb the further spread of the outbreak. And the quarantine authorities, together with such efforts, we need to cooperate with the public, and this is very crucial in order to minimize further damage. And in relation to the Itaewon Club cluster infection, as we are trying to curb the further outspread of the virus, we ask all of you who have visited these facilities from the 24th of April to May 6th to refrain from going outdoors and meeting people and get tested as soon as possible. We believe that many of the privacies and personal information about the confirmed cases are spreading online, and we would like to advise many of you to refrain from doing so. And we would like to make sure that the quarantine authority is protecting the individual's privacy as well as their private information when they come to the screening centers. So please come out to the screening clinics. And we are also utilizing the mobile traffic as well as the credit card usage and the CCTV surveillances to track down on these possible patients, and we are also cooperating closely with the police agency. And relating to the Itaewon Club cluster infection, most of the patients are in their 20s and 30s, meaning they are very young, and they have many of them have no symptoms. However, they are widely engaging in activities, in daily activities, that is. So we believe that we have a wider risk of an infection. And the fatality rate of the COVID-19 is very high among the people who are over the 80s, and it amounts to over 20%. And we have witnessed a case where one grandson who has visited the Itaewon Club has spread the virus to his grandmother, who is in her 80s. So we cannot put our guards down, and we need to continue to be vigilant going forward. And we ask the rest of the members of the public to comply with the measures of social distancing within daily life and refrain from going to crowded and indoor places. Thank you very much.
네, 지금부터 질의응답 시간을 가지겠습니다. 배석자분들은
That was a live briefing from the South Korean health authorities updating us on the COVID-19 situation in the nation. We just heard that there were 27 additional cases of COVID-19, bringing the total to 10,936. There were also additionally 2 new deaths, meaning that the death toll now stands at 258. Well, that concludes our coverage of this morning's briefing. We're going to be back in just a little while at 12 p.m. Korea time with our regular midday news. Bye for now.